Infertility is the topic, and infertility is defined as an inability of a couple to conceive for greater than 1 year, despite the fact that they've been having unprotected sexual intercourse. Now, there are several causes of infertility, and we can break them into categories. And the first is a category that involves sperm disorders, and we'll label that as a male factor. And that's about 35% of cases of infertility. The next one is problems with either the egg, also known as the oocyte, with decreased ovarian reserve, or the ovary just doesn't have as many eggs as it normally would, or a problem with actually having enough eggs but they're not being secreted, ovulatory dysfunction, improper ovulation. And that together makes up about 20% of the cases of infertility. Then you have problems with the fallopian tube, or the actual uterus, or the cervix. So the anatomy, and those are conveniently known as Tubal factor or uterine factor for obvious reasons. And those make up about 35%. And then the final 10% are essentially unexplained causes of infertility or unidentifiable causes of infertility. Now, what is the management? In general, the first thing that you tell the couple is to increase the sexual intercourse during periods of ovulation. Now, how do you know when ovulation is occurring? Well, you can sort of just tell them to measure their cycle, and ovulation is most likely occurring in between the cycles. Or you can measure basal body temperature, and this reading can help guide you. For example, when the body temperature decreases, it suggests that ovulation is about to occur. Another thing that can be used are these LH prediction kits. You can actually buy these, and what they do is they help identify an LH surge, and that can help predict when ovulation is going to occur. Now, what about if you have very specific problems, such as the fact that there just isn't ovulation happening? Well, fortunately, there's a medication known as clomiphene, and clomiphene is a very popular drug that helps to trigger ovulation. I wanted to also talk about another problem, solution rather, and that is in vitro fertilization. In vitro fertilization is actually a very modern way of handling infertility. Basically, you take a sperm and an egg and you fuse them in vitro in a test tube, and then you implant the zygote into the uterus. And that can be done when you have problems with the fallopian tube, for example, or problems with the oocyte, ovarian reserve being decreased, or problems with the sperm, where there's not enough sperm to fertilize an egg. And then one final thing I wanted to mention is sometimes the uterus itself, the lining of the uterus, is incompatible with implantation. And the reason is because there's a lot of adhesions or scar tissue, and that needs to be removed. And this can happen when people undergo repeated DNCs, and we'll talk a little bit about that when we get to the clinical vignettes. And here they are. So, for each of these clinical vignettes, choose which one of these causes of infertility are responsible. So let's start with the first one. 25-year-old woman, gravida 2, para 2, has been attempting pregnancy for the past 2 years. She has no medical problems. She had surgery for a ruptured appendix 5 years ago. Her periods are regular and last 3 to 4 days. She denies smoking, drinking alcohol, or using drugs. Husband is 28, is healthy, and has normal sperm count. Okay, well, the only thing they told you in this question is that she had a ruptured appendix. Not much information. But from that, we can deduce that she probably had some adhesions because she had surgery. And the risk of adhesion formation is very high. Now, the appendix is at close proximity to the fallopian tube. So what's probably happening is that she has adhesions of the fallopian tubes to other structures in the vicinity. And what that does is it prevents proper egg retrieval once the egg is being released, and also prevents proper transport by the fallopian tube of this egg, and that can lead to an ectopic pregnancy where the egg just cannot travel all the way to the uterus to be implanted. So this most likely is due to tubal factor, so choice C. So this would be choice C, tubal factor, a problem with the fallopian tube. Next one, 29-year-old woman, gravida 5, para 1, with a history of 4 terminations of pregnancy by suction curettage, presents to you because she has not been able to conceive since her last termination 3 years ago. Since that time, she notes that her periods, although regular, have been much lighter and lasting only 2 days. Her husband, 34 years old, and is healthy. Well, she's had multiple DNCs, dilation and curettage, and that scraping of the inside of the lining of the uterus has led most likely to adhesions and fibrosis of the endometrium. And there's actually a name given to this. It's called Asherman's syndrome. And because of this adhesions and fibrosis of the endometrium, it's preventing the normal endometrial proliferation. And essentially it's also preventing a zygote from being able to implant properly into the lining of the uterus. So this is involving the uterus. So this would be uterine factor, so choice D. Next question. 30-year-old newly gravid woman presents to you because she and her husband have been trying to get pregnant for the past 2 years. No past medical history. She has regular 30-day menstrual cycles and denies dysmenorrhea. Pelvic exam is normal. Lab testing on cycle day 3 is normal. Ovulation is confirmed. By mid-luteal phase progesterone level, you perform a hysterosalpingogram that shows a normal uterine cavity and patent bilateral fallopian tubes. Husband is 31 and has normal semen. Analysis. Well, we have a normal female and a normal male, and we still have infertility. So this I would probably put as an unexplained, because we're not sure. The clinical vignette simply doesn't give us enough. So the answer for that would be F. Fourth one, 42-year-old woman, gravida 1, para 0, spontaneous abortion 4 years ago, presents with 2 years of secondary infertility. She has no medical history and has regular 30-day menstrual cycles. Pelvic exam, you note an antral follicular count of 4 from the 2 ovaries. Hysterosalpingogram that you perform shows normal uterine cavity and bilateral tubal patency. Husband's semen is normal. Okay, the key is this right here. Basically, an antral follicular count. What is that? It basically tells you about ovarian reserve. How many eggs are still in the ovary? And each of these follicles basically contains an egg, an oocyte. Okay? And the normal antral follicle count is about 22 to 35. So this patient has 4, which is very low. So this patient definitely has decreased ovarian reserve. So her ovarian reserve is definitely decreased. And which one of those choices would this be? This would probably be choice B, which is oocyte equality problem. So number 4 is B. And then number 5, a 27-year-old woman, gravid at 2, parent 2, with regular cycles, presents to you because she has not been able to get pregnant after reversal of husband vasectomy. She has no medical problems. Well, this one's an easy one. Not all vasectomies, when they're reversed, work out the way you think they will. Unfortunately, some vasectomy reversals are not successful. So this is without a doubt a male factor as the reason for infertility. So the answer for that is E. And then the final one, 22-year-old newly gravid woman and her husband have been trying to get pregnant for the last 18 months. She has no known medical problems and has never had any surgery. She says her periods are irregular. She gets about 4 to 5 periods per year. She is 5'2", weighs 210. On review of symptoms, she reports hair growth on her abdomen and chin. Okay, well, this patient is obese. She's quite heavy for her height, and she has this hirsutism. And then, obviously, she's coming to you for infertility. All this points toward PCOS, polycystic ovarian syndrome. And the main problem with polycystic ovarian syndrome is the infertility is happening because lack of ovulation. So of the choices listed, it would be choice A. So the answer to number 6 is A.